Hello everyone, this is Dr. Ira again. In the last video, we saw the difference between UMN and LMN at spinal cord level. In this video, we are going to learn one more important concept in spinal cord injury. So, अगर इंजरी C5 पे है तो क्या कॉर्ड का भी C5 सेगमेंट इंजर होगा? अगर आपका आंसर yes है तो then it's wrong. So let's clear the concept in this video today. So now look at the diagram. Here when you see these are the vertebral levels and on the other side there are the spinal segments. When you look at the cervical spine, here we have 7 cervical vertebrae and 8 cervical segments. So when you think about the level C5, then you will see that the segment corresponding to the vertebra C5 is actually C6. So in cervical, the level of injury would be +1. So C5 spinous process corresponds to C6 segment and so on, right? So in cervical, it will be +1. Now let's move on to thoracic spine. So in thoracic spine, the vertebral body of thoracic for the upper thoracic level is going to be +2. So for example, if you are thinking about the thoracic spine 2, that will corresponds to segment 4 of the thoracic vertebra, right? So for upper thoracic, the rule is going to be +2. Now here you have to look that at T9 level, the thoracic spine is ending altogether. So lower thoracic spine, if you think about from T7 to T12, it's going to be +3. So if you're thinking about T7 vertebral level, then the spinal segment would be T10. I hope this is clear now. Now let's look at the T9. Here the cord is ending, that we have already discussed. Now at the lumbar segment, the lumbar segment is ending between T9 to T11. So whole of the lumbar segments are included or lie between T9 to T11, and sacral and the coccygeal segment from T12 to L2. So this concept is very important when you are thinking about the injury and when you are assessing the patient on ASIA scale, right? So if you're thinking, for example, if you're thinking about C5 injury, then the segment would be C6. So at C6, you will get the lower motor neuron type of a picture, and sub C6, that is below C6, you are going to have a upper motor neuron type of paralysis, that would be spastic paralysis, right? So for example, let's again think of the injury which is at this level, that is T3 fracture. So which segment is involved? So now if you are answering that it is T5, then you are right. So correct answer will be T5, as the rule in the upper thoracic spine is +2 segment. So I hope this makes it very clear and you will be able to now localize the lesion in spinal cord injury with confidence. For more such videos, like and subscribe. Thank you.